سلام بچه‌ها، امروز اومدیم بیمارستان اولمپیس رو بهتون معرفی بکنم. درست تو قلب کنیانتی. این بیمارستان همه خدمات درمانی از اورژانس و آی‌سی-یو گرفته تا عملیات زیبایی و جراحی. حالا اینکه شما ترجیحتون اینه که توی بیمارستان عمل انجام بدین یا کلینیک، بسته به عملتون داره. مثلا اگر شما بخواید عمل لاغری اسکی رو انجام بدین، قاعدتاً باید بیاین توی بیمارستان این کار رو انجام بدین، چون بستری داره و نیاز به مراقبت‌های ویژه. ولی اگر عمل شما بلفاروپلاستی باشه، چون تایم عمل شما تایمش کوتاه هستش، در نتیجه کلینیک گزینه مناسب‌تری براتون هستش. حالا اگر بخواید در مورد این بیمارستان انواع عمل‌هایی که انجام میده، پزشکا و هزینه عمل اطلاعات لازم رو داشته باشید، به سایت ما مراجعه بکنید. اطلاعات کامل اونجا هست و میتونید مشاوره رایگان داشته باشید تا برای عملتون برنامه‌ریزی کنید.
برو تو بیمارستان، برو تو. برو تو، برو.
Please introduce yourself.
My name is Mohammed. I'm the manager of this facility, and we have been working in this facility for the last 18 years. And I have been working personally for the last 18 years here.
What type of procedure are most commonly preferred? Rhinoplasty, lipomatic, blepharoplasty, or?
I can describe this in three types of surgeries. One of them is, as you have mentioned, plastic aesthetic surgeries, which is being done by the plastic surgeons, including liposuction, breast reduction, abdominoplasty, they call it tummy tuck or sometimes mummy makeover. And plus rhinoplasty is an operation which can be done by ENT doctors, ear, nose and throat doctors, and the plastic surgeons as well. Because most likely the problem comes from the inner part of the nose in some cases, and not only the plastic surgeons, also ENT doctors are getting involved with the surgeries. And there is another thing, we call it obesity surgery for losing weight. And if a person has tried to lose weight and no matter what they have done, if they couldn't solve the problem, they prefer gastric sleeve operations, gastric bypass operations as well. And also it's letting people like 2 years period to get new life habit and to lose weight. Because after the operation instantly people are starting to lose weight. But for all these procedures we need to see if the patient is suitable, because you cannot perform all these surgeries to anyone who is asking for that. You need to make examination and you need to decide in an ethical way and in a formal way if the patient is suitable.
Which countries do most of patients come from?
Most likely European countries, if we name it as a continent. UK, Germany are the leading countries that are. Yeah.
How long do patients usually stay after surgery?
It depends on the patient's recovery process, but let's go with, for example, rhinoplasty operation. After rhinoplasty operation, we want the patient to stay in the hospital one night, but we want the patient to stay up to 1 week minimum after discharge plus 6 days to see whether it's going to be a bleeding or not, because we want to stay in the safe zone. But in plastic surgeries, for example, if it's a breast reduction, the patient needs to stay after the surgery 1 night and minimum plus 4 days in the town to make the controls. Because like after 3 or 4 days later, we ask the patient to come back and we make the wound dressing. The doctor sees the progress and decides whether if we need to proceed as it is or if we need to change something. But for example, for gastric sleeve operations, we require the patient like 4 days in the town, and in the whole period they are staying in the hospital. It's a different procedure. The patient needs to stay like minimum 3 nights after the surgery, and after that, if they are feeling comfortable, they can just fly back home.
Do they offer translation services or hotel accommodation?
Yes, we have in the hospital like 7 or 8 languages: English, German, Italian, French, Russian, Kazakh, Arabic, Persian. As well, we are providing translation services, but it's not. We do not call it as an extra service. I mean, we don't charge for it. When the patient comes, we want them to stay in the hospital as they are staying at home. So our friends are trying to help them all the time, and we have no language problem. And of course, we are not a travel agency, so we don't want to get involved with the hotel and accommodation options, but we still can help for that because the whole period, like 1 week, during the whole stay of the patient, we want the patient to stay close. For example, we are using or we are suggesting a hotel, a 3-star hotel nearby, which is just 100 meters from here. The point is, if the patient needs an extra care during their stay, just in 3 minutes I can send a driver and pick them from hotel and bring it to the hospital, because this is a hospital working 24 hours 7 days, so we all the time want everything to be under our control. So yes, there are some hotels that we can provide, but mainly we don't want to get involved with the financial situation of the hotels, but if they need to, we can somehow find a solution.
Thank you.
You're welcome.
And if my follow